My name is Glenn Raup, and I'm the Executive Director of Emergency Services at St. Joseph Hospital of Orange. And I'm here today to talk to you about an exciting project that we have going on right now, our expansion of services here at the Emergency Care Center in our facility. Emergency Services is the central point of access for anyone requiring access to services in the United States of America. And as such, the burden on emergency departments continues to grow as more and more people gain access and more providers are needed to be able to provide that care. The only area that is open 24/7, 365 is an emergency department. Our emergency care center sees approximately 80,000 patients a year, and we are the hub for the Central Orange County area for access to services and care. Our ability to have the space, the physical space, as well as the computers and IT infrastructure to be able to provide diagnostic testing, diagnostic results, and interventions to be able to meet the needs of these vulnerable patients is critical. The ability to shave off little bits of time all throughout the care process becomes critical. One of the ways to do this is reshape the rooms, the layout of the rooms, and the physical flow of patients into and out of the department. So I want to talk to you a little bit today about what some of these changes will be, what they would look like, and how they can make the care process better for the patients that we serve. We have constructed a process whereby the changes in the physical layout will enable us to have multiple providers at point of entry, along with the computers and infrastructure to support the arrival of multiple patients at the same time. This process will enable us to shave off minutes of time, moving the patient with rapid and accurate identification back to the providers in an even more timely manner. The next component is the initiation of our Rapid Medical Evaluation Rooms, or our RME rooms. These rooms will enable us to take care of a very low acuity patient. Once we've determined through triage or through that arrival assessment process that the patient is in a situation for care that is of a lesser acute nature, we can use these new rooms to be able to get them back to a provider, have minimal diagnostic testing, and facilitate movement of them out to clinics and other care providers where they need to be without having long waits and having the patients then leave in a very dissatisfied manner. The next exciting change that is occurring with this renovation is the improvement of layout with our fast track or our minimal to medium acuity area. This area requires a level of focused diagnostic testing, and the layout of these rooms and the ability to provide interventions of scalable nature becomes critical. Secondly, along with those rooms, the ability to move patients into and out of those rooms to allow a greater volume of patients into and out of those rooms becomes critical in the form of the layout as well as the computerized infrastructure that's in those rooms to support the providers and the patients access to their diagnostic information, their testing information, as well as their interventions. The layout of these rooms with the access to medications, with access to radiology, as well as diagnostic laboratory testing also becomes critical in facilitating and shaving off minutes of time to be able to move patients into and out of this area. To that end, another component of the renovation is the centralized location within the department of our laboratory component. This laboratory component will be an expansion of our diagnostic laboratory services where we can position a laboratory technician to provide phlebotomy or taking of blood from a patient to be able to process it for testing and results. And we can do this in a much quicker manner when we have this location physically present in the department. and this will enable us to, again, shave off more minutes of time. Lastly, the ability to track patients throughout our whole system becomes critical. And part of this renovation process will involve placing computers in different rooms as well as different locations, along with different providers, use of mobile computers as well, to be able to facilitate tracking of patients and tracking of providers. Again, to be able to provide the right information to the right provider concerning the right patient at the right time, all in an effort to be able to move patients through the system quicker, so again we can expand greater access to a greater number of patients. These are just a few of the exciting things we are doing here at the Emergency Care Center at St. Joseph Hospital of Orange.